Excretion. Excretion is the last part of pharmacokinetics. So pharmacology divided into pharmacokinetics as well as pharmacodynamics. So pharmacokinetics, absorption, distribution, metabolism and excretion of the drugs will be studied under pharmacokinetics. Under that, excretion is the last thing where the drugs, the metabolized and as well as unmetabolized drugs gets excreted from our body. So it's a passage out of systemically absorbed drug either as a metabolite or an unchanged drug. The major routes of excretion are kidneys, that means renal excretion. Other than that, fecal as well as biliary excretion and pulmonary excretion. So these are the major routes of excretion, and the minor routes are breast, saliva, sweat, hair, skin and tears. These are the minor routes of excretion. So as the picture indicates, so renal excretion, bladder, through bladder most of the drugs gets excreted. Kidneys plays important role in excreting the drugs. Other than that, lungs as well as the fecal excretion. So bile duct, the liver plays an important role in excreting the drugs. The minor routes are the sweat, saliva, like these things. So the main organ in excreting drugs is kidney. Whatever drugs we are taking, most of the drugs, 90% of the drugs will get excreted from our body through the kidneys. And excretion through kidney, that involves these three processes importantly: glomerular filtration, tubular secretion and tubular reabsorption. The basic unit of kidney, as we all know, is nephron. Nephron consists of Bowman's capsules, proximal convoluted tubule, Henle's loop, distal convoluted tubule, as well as collecting drug which leads to bladder as well as urethra. So glomerular filtration, tubular secretion, tubular reabsorption, these are the process which takes place in the nephron, which is mainly responsible for the excretion of drugs. The net renal excretion of drugs involves glomerular filtration plus tubular secretion, that is the amount of the drug that is filtered through glomerular filtration, that is Bowman's capsule, plus tubular secretion, the drug which is secreted inside the tubules, that means inside the nephrons to get eliminated from our body. The addition of these two minus tubular reabsorption, that means the body, our body absorbs certain important nutrients from the proximal convoluted tubule. So except this, the glomerular filtration and tubular secretion. So that is called as net renal excretion. So this picture clearly indicates the excretion process. The first thing, this is the Bowman's capsule. The first process is glomerular filtration of water and unbound drugs and metabolites. So most of the drugs, 99% of the drugs will get excreted or will get filtered in this Bowman's capsule. The second process is active tubular secretion of acidic as well as basic drugs and metabolites. So tubular secretion means this is our body. This is our body capillaries, the capillaries which are present in our body. From our body capillaries, drugs will get moved towards the proximal convoluted tubule. That is through organic anion transport as well as cation transport. It will get moved inside the proximal tubules to get excreted. So this process is called as active tubular secretion. The third process is active reabsorption. Our body gets reabsorbed from the proximal tubule, from the nephron. Our body reabsorbs back the important nutrients, sodium, water, calcium, minerals, so many things. It gets reabsorbed back by our body. So the urinary excretion takes place finally, which are collected in the collecting drug. So the net renal excretion is addition of this 1 and 2 minus 3 is net renal excretion. So the first thing in that is glomerular filtration. So all non-protein bound drugs, the important thing is either the drug is either lipid soluble or insoluble. Lipophilic as well as hydrophilic drugs, they get excreted towards the glomerular. And protein bound drugs, plasma protein, the drugs which are bound to plasma protein, they are not getting excreted through glomerular filtration. So the drugs which are having high molecular size, the drugs which bounds to plasma protein bound in, these two are the major things which won't get excreted through glomerular filtration. The glomerular filtration mainly depends upon the renal blood flow, that is, which is called as RBF, renal blood flow. So, depends upon that, the normal glomerular filtration is 120 per minute. And it may change in patients who are having renal failure as well as in aged persons. So, if it changes means the amount of drug that is filtered towards the proximal tubule through Bowman's capsule will be reduced. So, these are the factors which modify the glomerular filtration rate. Otherwise, the normal GFR is 120 per minute. So, accordingly, most of the drugs are excreted towards by this glomerular filtration, either lipid soluble as well as insoluble. The only thing is protein bound drugs won't get excreted through glomerular filtration. The second one is tubular secretion. The tubular secretion is the one where, as we have already seen, tubular secretion is the thing where certain organic anionic drug as well as acidic drugs, basic drugs, they get excreted to the tubules through certain transporters.